On the Health Watch tonight, we have a story every parent needs to hear. Our Dr. Mallika Marshall joins us now. Doctor, for the first time, there's actually a new study that shows screen time in infancy can lead to behavioral problems later in childhood.
Exactly. Listen to this. It was an international team of researchers, including here at Boston Children's Hospital, that followed 400 kids from 1 to 9 years old. And they asked their parents about screen time. They examined the electrical activity of their brains at 18 months, and they collected information about their executive functioning at age 9 using neuropsych testing as well as teacher and parent questionnaires. Now, they found that for every hour of increased screen time in infancy, it was associated with a decrease in measures of attention and executive functioning at age 9. They also found that babies with more screen time showed changes in brain activity associated with difficulties in attention. Now, we know that the American Academy of Pediatrics recommends that young children stay away from screens until they're at least 18 months of age, and that screen time really should be limited to no more than 1 hour a day for kids ages 2 to 5.
Yeah, and you've warned against that for a long time, so this is just further proof that we need to keep our babies from the screens.
Exactly.
If you snore, you know who you are. Should you be keeping an eye on your blood pressure?
Yes. These are researchers in China. They studied the genetics of 500,000 people and found that snoring and sleep apnea were associated with a higher risk of high blood pressure and heart disease. They say the link between snoring, sleep apnea, and heart disease may be driven in part by obesity. They say that losing weight could reduce the risk and that people with severe sleep apnea should have their blood pressure monitored more closely.
Okay, and grapes. They could actually help ward off a sunburn. This is important.
This is important, but more research is needed, as usual. But sunburns, especially those in childhood, actually increases the risk of melanoma. So researchers at Western New England University in Springfield, Massachusetts, asked 29 people to consume packets of freeze-dried grapes, equivalent to 3 servings, every day. After 2 weeks, they found that 9 of the participants had reduced sensitivity to UV exposure. They also discovered that the microbiomes of individuals may explain why some people had a greater response to the grapes than others. But like I said, more research needs to be done, so please don't think that you can go out and just eat a bunch of grapes and that you don't have to wear your sunscreen or avoid excessive sun exposure, because you still have to do those things.
But freeze-dried grapes, not raisins.
That is correct, at least in this study.
Okay. Doctor, thank you.
You're
David?
welcome.